Watch, where we discuss all the topics trending in the medical world. We're sending things over to FOX61's Tim Blammers in Studio 61 for much more.
Yes, good morning, everybody. We're happy to be joined once again by Dr. Syed Hussain from Trinity Health in New England to talk about all the things that all of you are talking about in the health world.
Good morning.
Sir, good to see you.
Likewise.
All right, we're going to start with what people generally call, I think, the stomach flu. And just to be clear, it's a misnomer. I've always hated it. It's not influenza. When you get that stomach bug, it's probably norovirus, which we're seeing a lot of this time of the year, especially in the Northeast. But that's not all that uncommon to see a rise in cases this time, right?
That's correct, Tim. This is the season for norovirus. What people need to be aware is it's highly contagious. As of mid-February, the CDC reports there's been a 13% incidence of norovirus in the Northeast, probably the most hardest hit right now. Like I said, it's very contagious. So it's spread by food, water, contaminated food, water, surface contamination, people who are sick who may pass it on to others. So, you know, adhering to the basic tenets of hygiene is important, washing hands, etc. There is no cure per se or vaccine for norovirus. So it's supportive management. If you do come down with symptoms such as diarrhea, nausea, vomiting, then it's really, really important that you hydrate yourself.
Yes.
Dehydration is probably one of the most important things to look out for.
Yeah, without getting too gross here, there tends to be a lot of vomiting, a lot of diarrhea. That's just what your life is miserable for maybe, what, 1 to 3 days?
That's right.
What happens if you're still feeling sick after about 3 days?
You need to see a provider.
Yeah.
To get checked out for other things that may be going on.
So just remember, the hand washing, that's something all of us, myself included, I'm probably not as vigilant doing it with the rubbing for as long as I should. So keep that in mind. All right, moving on. Talk show host Wendy Williams just shared that she has frontotemporal dementia and progressive aphasia, the same two problems that we just found out about with actor Bruce Willis. I don't know about all of you. I had never heard of either of these things beforehand, and here we are now. Does that mean this is common and it's just being heard about the first time?
So this is still a relatively rare condition, Tim. It's incredibly sad. What happens in frontotemporal dementia is that parts of the brain that are responsible for language and behavior get impacted. So what happens, usually anywhere from the 40s to age 60s, early 60s is when people get diagnosed. They may have loss of inhibition, or they may be doing acts which may, be antagonistic, for instance. There's change in personality, basically. And also there may be difficulty in expression, aphasia, or, trying to find the right words in terms of speech. So there is no treatment. There's supportive management. Sometimes there's an overlap with Parkinson's disease, symptoms similar to Parkinson's, and so antidepressants may be used, for instance, or speech therapy, but there is no cure for this, and it does take a toll. It takes anywhere from 2 to 10 years to progress. It's a relatively long course, but it's one of those conditions that we've had 2 high-profile diagnoses recently.
Yeah, and I want to talk more about that, but we have one more thing to talk about here. A new review from JAMA Psychiatry that said maternal mental illness is the leading cause of pregnancy-related deaths in the entire United States, about 1 in 4 of them. What is driving this? Why is that so high?
Yeah, this is incredibly sad, very concerning. If you look at where we are compared to other high-income countries, Tim, maternal mortality is very high in the U.S.
Yes.
And now there's a new study out that shows that mental health is one of the leading causes of death, and that could be either suicide or opioid overdose in mothers who may be pregnant. So what it goes back to is going back to the basics. Public awareness, policymakers need to have, put this front and center so we have more resources. There needs to be screening. There needs to be better access to care. We also see disparities that we've discussed previously. So Black women will be more likely to be diagnosed with this condition, and half as likely as white women to get treatment. So again, it goes back to the same topics we've discussed previously, but it is very concerning.
Yep, something we've heard of a lot. Minority groups getting hit the hardest, but again, this is something that is hitting every demographic. It's just one area where the United States is really falling short.
And there's a stigma still attached to mental health, which we need to do a better job in removing and talking more publicly about what symptoms to look for and what are the treatment options available, Tim.
So we will keep talking about it in the coming weeks. Doctor, thank you so much.